Hi everyone, my name's Kate. I'm a fourth year nursing student at the University of Saskatchewan. Today I'm going to be talking about consent, STIs, and safe sex. So we're going to start with talking about consent. I put the little T icons in there as some of you may have watched the T consent video. If not, I highly recommend you look up in YouTube T consent video and give it a watch. But overall, I'm just going to kind of briefly talk about consent. So consent is an enthusiastic yes. It is essential to gain before engaging in any kind of sexual activity. And there's key components to consent, which include clearness, coherence, ongoing, willing, and informed. So consent needs to be clear, meaning it's verbalized. It cannot be assumed or implied. It needs to be coherent, meaning that it's sober. One can't be incapacitated by drugs or alcohol. In order to give consent, you must be sober. Ongoing consent means it's present every step of the way, and consenting to one activity does not mean you consent to other activities. Willingness means everyone wants what is happening, and no one is being pressured or forced into doing anything they're uncomfortable with. And informed means an individual is given all information on what they are consenting to. So instead of putting the T video in, I put this image in. Really talking about asking first before doing. So does this feel good? I'd like to talk about this first. Having a safe word can also help with consent to know when somebody doesn't want something done, then saying that safe word and your partner or partners will know that they need to stop. Being very clear, I like my ears kissed, but not my neck. Asking, do you like this? Asking, may I kiss you? No, I don't want that, or I don't want to do that. And then really asking, do you like this? And the question about what turns you on, having that conversation with your partner or partners can really lead to a better understanding on what feels good for them, what feels good for you, and what is okay to do, what's not okay. I really want to talk about the key one here is if I change my mind, we will stop, which is very important. Consent can be given or taken at any point in time. So if consent is taken or it's not given, then any activity either needs to not progress or needs to stop if it's already begun. So STIs, I'm going to cover 8 STIs today. I'll kind of talk about how they spread, what their symptoms are, and then what testing and treatment are for each of them. So the first two I'm going to talk about are chlamydia and gonorrhea. Chlamydia is the most common STI in Canada. It's spread through unprotected sex. Majority of all of these are spread through unprotected sex. So when I say unprotected sex, I'm talking about either unprotected anal, vaginal, or oral sex. For chlamydia, symptoms in females can include vaginal bleeding or discharge, pain during sex, or lower back pain. In male, symptoms are testicular pain or swelling or penile itching. Testing for chlamydia is a urine test, and treatment is through a dose of antibiotics, just a pill. Gonorrhea is also spread through unprotected sex or sharing of sex toys. Symptoms in females are quite rare, but when they do present, they're identical to chlamydia symptoms. So the vaginal bleeding or discharge, pain during sex, or lower back pain. Male symptoms for gonorrhea include yellow or green penile discharge, testicular pain or swelling, or penile itching. Testing for gonorrhea is also done through a urine sample. And gonorrhea is also treated with a single dose of antibiotics. It's important to note if you're going in to get STI testing done, typically if they take a urine sample, they're testing for both chlamydia and gonorrhea. They won't just test for one or the other. So our next two are syphilis and HIV. Syphilis is spread also through unprotected sex. Its symptoms are not always present, but if there are symptoms, they can include small painless sores on the genitals, anus, or throat. This depends on what type of sex you're having, where they will present. Testing for syphilis is done through a blood test, and treatment is through an injection of antibiotics. The amount of treatments you'll need for syphilis depends on what stage you're at. Early syphilis typically is 1 dose of antibiotics. Late or latent syphilis can be up to 3 doses. For HIV, it's also spread through unprotected sex or bodily fluids. So bodily fluids can include semen, vaginal fluids, anal fluids, blood, or breast milk. Symptoms of HIV are often not present, but if they are, they present like flu symptoms, so kind of rash or joint pain. Testing is done through a blood test, and currently there's no treatment or cure, but antiretrovirals are given to those who are HIV positive to reduce the viruses present in the blood. So the next two are HPV and genital herpes. HPV is also known as human papillomavirus. It's spread through unprotected sex, again, vaginal, anal, or oral, and there's typically no symptoms that present. If symptoms do present, they'll usually show up as warts on either the penis, vulva, or anus. Diagnosis is done through a visual inspection by a healthcare provider and a pap test. Just a note on pap tests. For females, they're recommended after age 21, and they're recommended every 2 to 3 years. Treatment for HPV, the immune system will clear the virus on its own within a year or two, but there is a vaccine available for prevention. So before infection, this vaccine is available for females aged 9 to 45 and males aged 9 to 26. Genital herpes is spread through unprotected sex, again, vaginal, anal, or oral. Its symptoms typically include fever or aches, blisters or sores around the genitals or rectum, painful urination, itching, or tingling. Testing is through a swab of an active blister. And again, there's currently no cure for genital herpes, similar to HIV, but treatment with antivirals can help reduce the duration and severity of genital herpes outbreaks. So our last two, trichomoniasis and pubic lice crabs. Trichomoniasis is also called trich. So trich is spread through unprotected sex or sharing of sex toys. Its symptoms differ between females and males. In females, it can include an off-white or yellowish green odorous vaginal discharge. It can include vaginal itching or painful urination. For males, symptoms include painful urination or discharge from the penis. Testing is done through a pelvic exam by a healthcare provider, and they'll typically take a swab to send to the lab. And treatment for trich is done with a dose of antibiotics. For pubic lice or crabs, they're more uncommon now due to the popularity of trimming pubic hair, but symptoms can include skin irritation or inflammation, itchiness, and redness. And pubic lice is spread during intimate sexual and non-sexual contact. Testing for crabs is done by visual inspection by a healthcare provider to actually look for any visible lice. And then treatment for pubic lice is a cream that is put over top of the area. So just an overview, the urine test tests for chlamydia and gonorrhea. The blood test is for HIV and syphilis. Specifically for the University of Saskatchewan students, Student Wellness Center will do urine testing and give out blood requisitions to get the blood testing done. If you're not a University of Saskatchewan student, any walk-in clinic will be able to do STI testing, as well as Saskatoon Sexual Health is a great resource for STI testing and any education or information you're looking for regarding sexual health. And then Life Labs in Saskatchewan is where you can go to get your blood work done. But again, you need the blood requisition from your healthcare provider before you can go get your testing done for HIV and syphilis. So when to get tested, this is quite a lengthy list. It's not complete at all. One thing that's not on there is it's recommended once a year if you're in a monogamous relationship. And if you or your partner have multiple sexual partners, it's recommended every 3 to 6 months. Ultimately, there's no wrong time to get tested, even if it's just for your peace of mind. But this list kind of talks about if you have unprotected sex, if a condom breaks, if a partner you have had sexual intimacy with has or had an STI, if you or your partner injects street drugs, if you have a new sex partner, if you've more than one partner in the past 6 months, if your partner has or had sex with another person, if you have sex under the influence of drugs or alcohol. This one's more related to a decrease in the use of barrier or condoms. If you're unable to communicate with your partner about your sexual history or ways to reduce risks, and it's recommended to get tested if public health contacts you to say you've been in contact with somebody who has a reportable STI. So safe sex. Always give consent, always be safe, use protection, clean sex toys between uses, and get tested when necessary, or even again, if it's just for your peace of mind. Condoms can be quite expensive, so there are quite a few sexual health centers that actually will hand them out for free, or have them at a reduced cost. Here in Saskatoon Sexual Health do have condoms at a reduced cost, and they also sell sex toys at a reduced cost. So just keep that in mind if that is of interest.